Men are often expected to be strong, stoic, and independent. They are taught to hide their emotions, avoid vulnerability, and cope with stress on their own. But these cultural norms can have a negative impact on their mental health and well-being. According to the National Institute of Mental Health, NIMH, men are less likely than women to have received mental health treatment in the past year. However, they are more likely to die by suicide than women, according to the Centers for Disease Control and Prevention, CDC. Men also face unique challenges and risks when it comes to mental health. Some of the mental disorders affecting men include anxiety disorders, including social phobia, panic disorder, agoraphobia, and other phobias. More than 3 million men in the U.S. have an anxiety disorder. Attention deficit hyperactivity disorder, ADHD, which affects about 4.4% of adult men in the U.S. Autism spectrum disorder, ASD, which is 4 times more common in boys than girls. Bipolar disorder, which affects an equal amount of men and women, but may present differently in men. Men with bipolar disorder may experience more severe manic episodes, more irritability and aggression, and more substance abuse. Depression, which affects over 6 million men per year in the U.S. Men with depression may experience symptoms such as anger, irritability, loss of interest, fatigue, insomnia, and suicidal thoughts. Men are also less likely to seek help for depression or to admit feeling depressed. Eating disorders such as anorexia nervosa, bulimia nervosa, and binge eating disorder. Though men account for about 10% of patients with these disorders, they are less likely to seek professional help. Men with eating disorders may face stigma, shame, and denial of their condition. Post-traumatic stress disorder, PTSD, which affects about 3.6% of adult men in the U.S. Men are more likely to experience trauma from violence, accidents, or combat than women. Men with PTSD may experience flashbacks, nightmares, avoidance, hypervigilance, and emotional numbness. Substance use disorders, SUDs, which affect about 15.6% of adult men in the U.S. Men are more likely than women to use alcohol and drugs as a way of coping with stress, trauma, or mental health issues. Men are also more likely to develop dependence or addiction to these substances. These mental disorders can have serious consequences for men's physical health, relationships, work performance, and quality of life. They can also increase the risk of chronic diseases such as heart disease, diabetes, and cancer. The good news is that mental disorders can be treated effectively with a combination of medication, psychotherapy, and lifestyle changes. The first step is to recognize the signs and symptoms of a mental disorder and seek help from a qualified professional. Some of the signs and symptoms that men should look out for include anger, irritability, or aggressiveness, noticeable changes in mood, energy level, or appetite, difficulty sleeping or sleeping too much, difficulty concentrating, feeling restless or on edge, increased worry or feeling stressed, misuse of alcohol and/or drugs, sadness or hopelessness, suicidal thoughts, feeling flat or having trouble feeling positive emotions, engaging in high-risk activities, aches, headaches, digestive problems without a clear cause, obsessive thinking or compulsive behavior, thoughts or behaviors that interfere with work, family, or social life, unusual thinking or behaviors that concern other people. If you or someone you know is experiencing any of these signs or symptoms, do not hesitate to reach out for help. You can talk to your family doctor or visit NIMH's Help for Mental Illnesses webpage for more information and resources. You can also call 911 or call or text the 988 Suicide and Crisis Lifeline at 988 if you or someone you know is in a crisis. Remember that you are not alone. There are millions of men who struggle with mental health issues every day. There is no shame in asking for help. There is hope and recovery for everyone. Thanks for watching this video. If you liked it, please give it a thumbs up and share it with your friends. And don't forget to subscribe and hit the bell icon to get notified of my new videos. Also, let me know in the comments what you think and what you want to see next. That's it for today. See you in the next one.